Hello, and welcome to this YouTube video about the most harmful foods for the prostate. The prostate is a small gland in the male reproductive system. It produces seminal fluid, which helps to nourish and transport sperm. Keeping the prostate healthy is important for urinary health and reproductive health. Consuming certain foods can cause harm to the prostate and increase the risk of urinary problems or even prostate cancer. In this video, we will be discussing the most harmful foods for the prostate and how they can affect your health. So, without further ado, let's get into it. Drinking too much alcohol is not good for the prostate, as it can worsen the symptoms of lower urinary tract issues, such as weak urinary flow, inability to completely empty the bladder, or difficulty initiating urination. According to various research, the diuretic properties of alcohol can make prostate problems worse. Spicy foods make prostate problems worse. Patients suffering from urinary issues should stay away from spicy food items for the sake of their prostate, as even though they do not have a direct effect on it, they can irritate the bladder, possibly making urinary issues such as urgency and incontinence worse. On the other hand, research has linked components of spicy dishes, such as capsaicin, to beneficial effects in the prevention of cancer and other illnesses, including coronary and respiratory diseases. Saturated fats are not beneficial for one's health, and specifically, they do not contribute positively to prostate health due to their high inflammatory capacity and their ability to produce the most intense inflammatory cytokines. Evidence from various studies has even indicated that diets high in saturated fats can aggravate prostate cancer. Using too much salt when preparing meals can put you at a greater risk of having prostate-related issues, such as difficulty in urinating or not being able to empty your bladder completely. It has also been found that symptoms like having to urinate frequently and waking up during the night to use the bathroom can worsen. To avoid these issues, try to use spices to give your dishes flavor instead of salt. These spices have a variety of benefits, such as being anti-inflammatory, antioxidant, relaxing, antitussive, and aiding in digestion. Cheese and butter, according to a review of studies from the Mayo Clinic and published in the Journal of the American Osteopathic Association, are high in sodium and saturated fat, making them not ideal choices for those concerned about maintaining a healthy prostate. In Western countries, where dairy is the primary source of calcium, prostate cancer rates are higher. Meanwhile, Asian countries have lower rates because calcium is obtained from more of a green diet. Eating a lot of red and processed meat items like sausages has been linked to a higher chance of developing prostate cancer. Furthermore, when red meat is cooked at high temperatures, it produces a cancer-causing substance called acrylamide. In contrast, chicken doesn't appear to have the same effect, while fish can actually be beneficial since it is packed with omega-3 fatty acids. The Proteus study, conducted in Canada from 2005 to 2012, aimed to understand various aspects of health, behavior, and the environment. The study was comprehensive, involving multiple phases and targeting different populations to gather extensive data. It has indicated that consuming processed foods can increase the risk of many forms of cancer, including prostate cancer. The results of the study show that the more processed foods people ate, the higher the chance of developing prostate cancer. Such processed foods include pre-cooked meals, industrial drinks, hot dogs, cakes, cookies, breakfast cereals, and fast food. It is best to avoid store-bought salad dressings and sauces, as they often contain high levels of saturated fat and sodium, as these are linked to prostate problems. Let's continue here with starch, and mostly starch in the form of white bread, pasta, and rice. Consumption of white bread, pasta, and rice is associated with an increased risk of an enlarged prostate. Now, the exact mechanism for why this happens is not entirely known, but it appears to be related to high glycemic index foods. These in particular, white bread, pasta, and rice, are higher glycemic index foods, and there seems to be some relationship between this and insulin signaling and an enlarged prostate. Now, the next one we're going to talk about is dairy products. This article, entitled Dairy Product Consumption and Prostate Cancer Risk in the United States, actually doesn't seem to show significant evidence for dairy being a cause of an enlarged prostate or a cause of an increased risk of prostate cancer. But there is some evidence. So I wanted to mention that here. Dairy products including milk, yogurt, and cheese. And again, high consumption may be associated with an increased risk of prostate cancer. So again, there's some mixed evidence here, but it may be prudent to avoid dairy products to avoid the possible risk of prostate cancer. Beer has also been associated with an enlarged prostate, so consumption of beer is known to increase prolactin levels. And high consumption of beer, so keyword here is high consumption, may increase the risk of BPH, benign prostatic hyperplasia, which is another term for an enlarged prostate. Now, this is not entirely clear, so if there is a risk or an increased risk of an enlarged prostate with beer consumption, it appears to be when your consumption is very high, and it is different than other types of liquor or alcohol. So, when other studies have looked at beer consumption when it's mild or moderate consumption, it actually may be protective against an enlarged prostate. But I wanted to mention that here, high consumption of beer may increase the risk of an enlarged prostate or benign prostatic hyperplasia, BPH. Because alcohol acts as a diuretic, it can increase the symptoms of an enlarged prostate. So it can increase the lower urinary tract symptoms. So symptoms of a large prostate can be worsened with beer consumption. Caffeinated beverages can also be an issue within a large prostate, not specifically because they increase the risk of enlarging the prostate, or they don't seem to be related to having any effect on prostate size. It's more because caffeine acts as a diuretic, so a diuretic will make someone go to the bathroom more often. So if an individual does have an enlarged prostate, it's best to avoid caffeinated beverages because they'll be going to the washer more often, and they'll have more symptoms of an enlarged prostate. So they'll have worsened lower urinary tract symptoms. And this is the same again with beer. So beer and alcohol can act as a diuretic, same with caffeine. This will worsen lower urinary tract symptoms. So both of these are good to avoid, especially in trying to avoid some of those symptoms of an enlarged prostate. Frequent urination, urgency, those types of symptoms. And there may be some associated risk with high consumption of beer in an increased risk of prostate enlargement. So again, good to avoid both of these. Both act as diuretics, and both can worsen those lower urinary tract symptoms associated with an enlarged prostate. Now, the next one we're going to talk about comes from a study titled High-Fat Diet Fuels Prostate Cancer Progression by Rewiring the Metabolome and Amplifying the MC Program, explores how dietary habits, particularly the consumption of high-fat diets, can influence the progression of prostate cancer. Here are some key points related to the study. So from that article, high-fat diets or foods that contain lots of fats or high-fat content can increase the risk of an enlarged prostate, but more specifically increase the risk of progression or increase the risk of prostate cancer itself. So, an increased risk of prostate cancer can increase the progression of prostate cancer. High sodium intake is also something to avoid within a large prostate. From this article entitled Dietary Macronutrients, Cholesterol, and Sodium and Lower Urinary Tract Symptoms in Men, the main reason to avoid sodium or high sodium intake is because this sodium increases symptoms that are associated with a large prostate, so it increases those lower urinary tract symptoms. So although the high sodium doesn't seem to be involved in actually making the prostate bigger or changing the size of the prostate, it will worsen the symptoms associated with an enlarged prostate. So again, high-fat diets increase the risk of prostate cancer and the progression of prostate cancer. So best to avoid high-fat diets and high sodium intake. Doesn't necessarily affect the size of the prostate, but it's good to avoid if you have an enlarged prostate because it increases symptoms associated with an enlarged prostate, like lower urinary tract symptoms. Remember, avoiding these foods and beverages can significantly improve your prostate health. Incorporating a balanced diet and healthy lifestyle choices is key. Regular checkups and consultations with your doctor are also important. Engaging in physical activities can further enhance your overall well-being. That was a lesson on foods and beverages to avoid. If you like this video, please give it a thumbs up and subscribe to the channel. Thanks for watching, and I hope to see you next time.